All right, let's call the Board of Health meeting together for December 5th, 2019. Start time of 12:30 p.m. Some of us thought it was earlier, but we're here, and I appreciate everyone coming. Could we get a roll call? Or do I do the roll call? I get mixed up on my boards with that. Yeah.
Josh Kern, Spokane County.
Michelle Fossum, Legal Counsel.
Kate Burke, City of Spokane.
Chuck Havner, appointed citizen.
Andrea Frostad, appointed.
Kevin Freeman, City of Millwood and Small Cities.
Bob Lutz, County Health Officer.
Amelia.
Ben Wick, City of Spokane Valley.
And Vice Chair. Brian Begg, City of Spokane, and Chair. I heard from Councilmember Stratton, who unfortunately has to be out of town, and as well as Ms. Cooney, although her reason is happier. She's getting the bond signed for the Sportsplex. So we'll do citizen input. We have one person signed up. That's Jacqueline Gallion. If you want to go to the podium, and we'll start the 3 minutes once you start.
Jacqueline Gallion, City of Spokane Valley. As I was thinking about what issues are most urgently needed to address in the Department of Health, what consistently comes to mind is failure and transparency. Failure is rampant and transparency is lacking, but the Department of Health actions are transparent in their misrepresentation. When the Department of Health pretends that there is a difference between personal, philosophical, and religious non-medical exemptions, instead of two sides of the same coin as intended by the legislation crafters, it is transparent failure. When creating this false distinction, this failure ignores the history of conscientious objection law in the U.S. established in the 1950s and 60s. This case law found that under the Equal Protection Clause, personal, philosophical, and non-church or organized religious beliefs are all equivalent. Washington law includes all three descriptors because our law dates after these cases to only the 1979-80 school year, 12 years after annual measles mortality dropped to 0. In 1969, only 26 states had school attendance laws. Washington was not one of them. It is a transparent failure when the Department of Health tries to pretend that Washington has always had school rules and that the exemptions were an afterthought or an indulgence to certain populations instead of an integral part of the original legislation. It is a transparent bad actor strategy to split the non-medical exemptions to remove them piecemeal. There is a famous video of Representative Harris advising constituents to switch to a religious exemption to keep their children in schools. It is a transparent ploy to now pretend that a rise in the religious exemption use was not expected and predictable and somehow constitutes some new issue. It is a transparent failure to pretend that hesitant parents are hesitant due to ignorance of the benefits of vaccines. I'm submitting a Department of Health PowerPoint slide from 2010 where they had already identified that hesitant parents are often more informed about vaccine risks and benefits than healthcare providers. It is a transparent failure to trust the HHS, CDC, FDA, etc. when regulatory failure is rampant. The exercise company CrossFit just won a lawsuit against HHS for failure to disclose conflicts of interest in received donations. CrossFit. There's a link there that you can go and read more into it. It is a transparent failure to say out of one side of your mouth to just get a medical while saying we need to tighten up medical exemptions out of the other. You have already terrified most physicians and medical providers into eliminating medical exemptions as practice policy, regardless of medical necessity. And it is a transparent failure to ignore the objective fact that disciplinary suspensions and expulsions removing children from the support system in schools are known to provoke self-harm attempts in some students. The state is failing in its legal duty to warn parents that the exclusion may cause sufficient stress to provoke a suicide attempt. It is a failure to recognize the lunacy of subjecting children to suicide risk when over 100 of our youth pass by suicide every year, a mortality rate eclipsing all of the vaccine-targeted infections since the 1930s economic depression. Please focus on success and honesty in the new year. Thank you.
Thank you for your time and sharing with us. That's the last of citizen input, but I want to recognize Councilmember Thompson for arriving. Thanks for coming. And we're now down to consent agenda, and we have 2 items included in the consent agenda: the meeting minutes of October 31st, 2019, and the vouchers from October 1st through 31st, 2019. I think both have been circulated. Any discussion or comment on those? I would invite a motion to approve the consent agenda.
Move approval of the consent agenda, meeting minutes and vouchers as presented.
Okay, it's been moved and seconded. Any further discussion? All those in favor, please indicate by saying aye. Any opposed, nay? Any abstentions? Okay, passes unanimously. That brings us to action items. The first one is the adoption of the 2020
Thank you. This is Resolution 19-07, the adoption of the 2020 SRHD budget. We did do a 2-touch time this year, and so we actually brought it to you in October, and brought it back for today to be considered for adoption. And I'll let you know that there was there was 0 questions asked since the last time I presented back in October on the budget, and nothing changed as far as the budget as it was presented at that time. As we're moving forward into the budgets, we are asking for the approval of the budget as we move into the 2020 year. And Administrative Officer Amelia Clark, as she's been here, she started to set up where we're really going to look at our budget moving into 2020 and have budget meetings with the division directors and the program managers and really delve deeper on our budget. Another thing that's going to come up as a change as we move into next year is sort of our presentation of the budget. We're working with our Budget and Finance Committee on more information coming out of the budget as we move forward into next year. But I would, at this time, ask if you'd consider approval of the 2020 budget.
Thank you. Are there any questions or concerns?
I just, one of the things is looking at more closely at a balanced budget, looking at, you know, and as I understand, going to meet with folks and kind of take a look at our overall budget and more explanation and more, I guess that's all I'm saying is I would really like to advocate to have that budget balanced for the incoming year.
Correct, and that's the direction from the Budget and Finance Committee also. So.
Aye.
All right, thank you.
Yes, hello. Good afternoon, everybody. Yep, you should have Resolution 1908 in your packet, adopting a Board of Health legislative agenda. We've been working on this with the policy committee since, I believe, October. And I know that the executive committee had some input on who we should be talking to through this process. So just to quickly cover the various inputs that have come into this, I've worked with WSALFO, Department of Health, Snohomish County Public Health, Seattle King County Public Health, City of Spokane Valley, Spokane County, Community Colleges of Spokane, GSI, Washington State Association of Counties, and Senator Patty Murray's staff people. This came also out of input from our systems mapping activities with community partners, and we can provide a list of who those folks are too if there's interest. But happy to take any questions, comments, amendments, or questions for the policy committee. Otherwise, would love to adopt this.
Could you just give a little further update on the updates you're going to make to the spreadsheet about legislation?
Sure. So you also have a sheet here that has a lot of tiny font on it. And this will, I will use this to track bills as they go through the session. And also track activities that are happening more locally that are related to the priorities. And so you see there's a status column. This has not been updated, but it will be. They're not necessarily dead. Yes, I will update this to say where they left off last session, and then as they go through session, if they do get picked up into committee and moved around, I'll make sure to keep them updated. I'm also keeping an eye on the bills that have been pre-filed, and we'll add those here and just use this to track and can keep you updated as we go.
Is there a motion to adopt Resolution 1908?
I move to adopt resolution 1908.
Is there a second? Second. Any discussion about the legislative agenda? Yes.
Just to confirm, what we are adopting is this resolution and our statements, not that we are supporting or opposing any of these bills on the supporting document, correct?
Correct.
Okay.
Any other discussion, questions, comments? Hearing none. All those in favor, please indicate by saying aye.
Aye.
Aye. And opposed, nay? Any abstentions? None. Okay. That also passes. Great work, everyone, on that.
Thank you. Just also a quick reminder that there is a GSI Legislative Forum on the 12th, if anybody's attending.
And the City of Spokane one as well, same day. And we've gotten, just FYI, we have gotten some good RSVPs on those, so there'll be some powerful people ready and willing to listen to us, so I appreciate that. Okay, next is Resolution 1909, adoption of labor contract for members of ProTech 17. Great.
Hi, Ray Byrne, Interim Administrator, and we have been in negotiations with one of our unions, PTE, which is now being referred to as ProTech. We wrapped up negotiations with them mid-November. They went to vote, ratified the contract, and we're now bringing that forward to the board for adoption. So as you see in the resolution there, we've highlighted a couple of the major points that we made changes to in the contract. The first being the compensation. We did agree with them on a 1.6% COLA for the upcoming year. And then as part of the contract also, they have agreed to open up the 2 consecutive years each year to negotiate COLA and benefits. The second point there is medical benefits. So the district agreed to increase the cost for the lowest cost plan, Kaiser Value, and meet that at 100%, and then adjust the other plans up to stay in meet the percentages that we currently do. So there was some minor changes there to the benefit of the employees. Bilingual pay, the district agreed to increase that from $1 per hour to $10 per hour. For that actually is a big benefit to the district, as a lot of times we use that. It may be a short turnaround for us. We have somebody on staff that can interpret for us instead of contracting that out. Typically when we contract that out, that can be $40, $50 an hour with a minimum of 2 hours payout. So this is a huge benefit to us.
That was the rationale of going from $1 to $10?
Correct. Correct.
And just to clarify, is that the $10 premium just while they're doing those services? So
Correct.
it's not the
No,
rest of the time?
no, it's just during services. And a lot of times, an example would be that we have somebody come to the counter up in environmental public health, and we have a non-English speaking client. The interpretation services may be for a span of about 15 minutes. So instead of paying 2 hours at $40 to $50 an hour, we're actually paying 15 minutes for that compensation. So, and then also as part of the Washington State Sick and Safe Leave Law, we used to offer a wellness day if employees use 32 hours or less of sick leave. That was an incentive. We can no longer do that under that law. So we have suspended that. We are going to honor if employees earned that this year, we will honor that and allow them to use that next year, but we can no longer continue that practice. And then another thing that we've been working on over the last few years is to get all employees within the district converted over to a pay leg system. We did negotiate that with PTE this year. They've agreed to that. We're going to implement that July 1st. And that allows the employees time to plan for that, because what's going to happen is currently there's going to be a lag in which they would go a month time frame without a pay. So we've agreed to pay half of that paycheck on the 10th and the second half on the 25th, and then allow them at a one-time cash in for some vacation to make themselves whole. So if they're struggling with the pay on that, they can compensate for that. But that's a one-time allowance. In addition to that, we're also changing the pay dates. So currently we pay on the 1st and the 16th, or 30th and 15th, sorry. There's been a law change on that, and if you pay bi-monthly, you're only allowed to have 10 days following the end of the pay period. So thus we're moving up the pay date to the 10th and the 25th. That brings us into compliance with that. And then the last things were more wordage in the contract that brings it up to meet current law or clarification, but the content of the articles didn't change. So with that, if there's no further.
Ray, you have a bullet here, union membership and dues. Does the district collect their dues from them?
We do. So currently we have an agreement with them that we collect the dues and pass it on to the union.
Do we have a procedure for complying with Janus if somebody does not want their dues collected?
Yes, we are in compliance, and we revised the contract language to be in compliance with Janus. And so the unions and through negotiations, we did have our employment law attorney, Beth Kennard, was part of negotiations, both with WSNA for their full contract last year and PTE again for the full contract this year to ensure compliance.
Thank you. Question answered.
Okay. Any other questions on the contract?
I'd invite a motion to adopt resolution 19-9.
Move approval.
Been moved and seconded. Any further discussion? Hearing none, all those in favor indicate by saying aye.
Aye.
Opposed, nay. Any abstentions? Okay, that also passes unanimously, which brings us to the next motion, very similar, 19-10. Mr. Byrne.
So this is very similar to the last one. We had actually agreed through negotiations with WSNA on a full contract, 3-year contract, which you guys adopted earlier this year for the years of 2019 through 21. As part of that, they agreed to open both COLA and benefits on an annual basis, which they did. We came to agreement with them and they ratified that, again at the 1.6% COLA and the same terms on the benefits. In addition to that, in this resolution, it's also asking for approval to keep that same theory with the non-rept, which would be the 1.6% COLA and the same match on the benefits.
Any questions on that resolution or contract? I'd invite a motion to approve 19-10.
Move to approve 19-10.
Second.
All right, moved and seconded. Any further discussion? Hearing none, all those in favor indicate by saying aye.
Aye.
Opposed, nay. Any abstentions? All right, that is also approved unanimously.
And if I could, one more thing.
Yep.
I would like to remind the board also that we are still in negotiations with PTE on the compensation project that we began last year. We hope to be bringing that to the board sometime right after the first of the year, sometime in the first part of the year. Okay, thanks.
Thank you. That brings us to elections for officers in 2020. And The first position we're going to do is chair. I am not going to serve as chair next year. I am looking for a motion to nominate. My understanding is Mr. Wick is consented to serve if chosen. Okay.
Second.
Okay. Any discussion? All those in favor, please indicate by saying aye.
Aye.
Aye. And any opposed, nay? Any abstentions? All right, congratulations. And then next up, vice chair position. My understanding is Commissioner Cooney is willing to serve in that role if nominated and chosen. I did speak with her just a few minutes ago, make sure she hadn't had second thoughts about that. And she is still excited to do that. So again, I would invite a motion of nomination.
I'll nominate Commissioner Mary Cuny for vice chair.
I'll second.
Okay.
Kate can have it.
All right. It's been moved and seconded. Any discussion? Hearing none. All those in favor indicate by saying aye.
Aye.
Aye. Opposed, nay. Abstentions? Hearing none. Ms. Cooney will join Mr. Wick as vice chair starting next year. All right. So I think that's the most voting I've experienced in the last 3 or 4 years here. So good job, everyone. For chair, that brings us to the chair report. And I had a couple of things I wanted to discuss. First of all, we have a new special phone chart for important numbers. So please take that home, put it someplace safely near a flashlight in case the lights go out and there's an emergency. And you need to know more information about what's going on. Secondly, I forget the day, Ms. Clark, but when did we present to the Board of Health? November 18th, the Board of Health was in town holding meetings at the Davenport, and Amelia and I presented. Mostly that would be Amelia, and had a very positive presentation. Lots of really positive feedback from the Board of Health members, and they really wanted to engage with her. We went on break immediately after, and so that was a great chance for our district to shine on that. So that was helpful. Then I also just wanted to note some of the conversation we've had in executive committee. Now that the elections are over, we know who the players are for the various jurisdictions, and just looking forward to opportunities to be a regional force for public health. And I think we've made progress in that in the last few years. And given the personalities involved, it seems like that is more than likely in the future, and just commending people to think about that. And my own proposal I put out there, we haven't really gotten it organized yet for this legislative session, but is to look at a regional legislative agenda. Not that each individual entity wouldn't have their own agenda, but figuring out if there's one or two points that really the whole region says, yeah, regardless of whether it was third or fifth on my agenda, that's the top two for the region. And so I've sort of commended that to GSI, commissioners, city council, and the policy committee. So just want to do that. And then that brings us to the policy committee. The education and the policy committees, my understanding, have recommended that they be combined as one. I don't know if anyone from those committees.
I hadn't heard that
You hadn't heard that, even though you're on it?
on the education committee.
Okay.
I know it's been discussed over the year, the past year, but isn't Karen the only member of the education committee?
Yeah, so I'll
the only
just
one who's been
put that
at
out
this.
for discussion. That came to executive committee as a recommendation. So I'm, especially since some of you weren't as aware of the recent conversation, I'd love to invite any feedback on that issue.
Well, I think that would be good, because we haven't really had any meetings on the education committee. There's been things done like talking about getting the board members to know about trainings that are happening that would be really helpful. And I'll just point out one, when we had, it was about inspections and work in with food, and there had been a webinar the day before that was referenced in the presentation that would have been helpful for us to know to watch for the presentation. And I'm just, so my suggestion is that we just talk about or have a way through the education committee to make sure folks are knowing what's happening. And that is happening now with getting the notices of different things that are happening so we can join in.
Maybe talk about the calendar that and how that aligns with the legislative areas that might give more context. You don't need to talk about that.
Yes.
Okay. So at executive committee.
Okay, now we're good. So some of the feedback that I've received from board members related to wanting more education on different topics and how that relates to strategy and then the legislative areas. I actually brought to the executive committee a calendar that kind of outlines what those education areas would be for 2020. And then that way we can start getting staff ready to prepare and speak about those topics at the different months. And then that's also an opportunity for anytime we can get you the presentation prior to the board meeting so that you could review it. And we're trying as much as possible to align things to the legislative agenda and how that can make an impact in the strategic plan. So that was kind of my request within that calendar. And then knowing that if there's an outbreak or something that we need to address, we can be flexible. You know, if something comes up we really need to talk about.
Yes, now that you've reminded me. So so the idea is just a master calendar of the president, just like we'll get one today, so that we know for the whole year what they are, and we can circulate that so people can look at it and then also request additional presentations. So the executive committee thought that was a good idea. Any other discussion about combining the education and policy committee or just committees in general as we get ready for the new year? I believe we have a document in our packet.
I don't think it
outlines.
does. I don't think it requires, but we might, if we do this, we might have to notice a public notice for the meeting because we might have more than half of a quorum. That was my understanding. That's what we talked about at our last meeting.
Yeah. So this is not slated as an action item for today, but at the next meeting we could take whatever action we need on that. But any other discussion about that? Okay, that sounds good. That's all I have.
just have one
Oh, yeah.
more. So reading through the bylaws, we will be picking or needing to identify the chairs of the committees for next year. So if you're interested in serving as a chair of a committee, let me know.
And I would just amend that if you have been serving and you don't want to serve, let us know that as well. So otherwise we're counting on it. And that also just goes to committee membership too, as well. So I would suggest let Ben and Ann know any changes or requests on that. Okay, that brings us to committee reports. And was there anything from budget and finance? I see a shake of the head, no. And nothing from education other than they want to be part of policy. Anything on policy?
I missed our last meeting, so was there anything that you guys wanted to update? Okay. We just had the proposal, so that we already voted on it.
Okay. Then, seeing nothing more about that, I'll invite our administrator to report.
So I'm actually, Breen mentioned that on November 18th, we presented to the State Board of Health on what's happening here in Spokane and also just doing a welcome. So in light of time, I've kind of pared down that presentation, and I'm going to share it with all of you, bearing in mind that when I did the presentation, I think that was day 61 on the job. So it was actually kind of fun for me to get to learn about the region even more, because I had to do some historical digging to find out some stuff. So we started with a welcome, and I really had a great opportunity, like I was mentioning just a few months in, to talk with the State Board of Health on what our strategies are here in the Spokane district, and how those relate to what's happening at a state level. And we welcomed, Chair Beggs and I welcomed everyone, not just from Spokane, but from all the municipalities and cities that comprise our district. And most of you already know kind of my background and experience, so I'll pass over some of that. But as I've kind of started forming my thoughts and ideas about where we are as a district, it's really helped me kind of see the past, present, and future of where we want to go as a district. And so as part of the presentation, we talked about the past, present, and future, and we went back to the 70s. So if you remember the 70s, lots of differences in cost of living. Gas was less than $1 a gallon, and I think I filled up for $3.08 the last time I put gas in the car. Marcus Welby was #1 TV show in the US. The Beatles officially broke up. There had been rumors for a long time. Love Story was the #1 movie. Spokane was in the process of getting ready for the '74 World Expo. And perhaps more importantly, the health district was formed, right? So 2020 is actually our 50-year anniversary. And so in 2020, as we kind of go into the future, from the Betamax fast forward symbol on the left side of the screen, my children don't even know what a VCR is, to the more current way we look at fast forward on the right. What began as an organization 50 years ago with 109 employees and a budget of just over $1.1 million has grown to an organization of 267 employees, and last year a $32 million budget, which in 2020 we just approved will go to 39. And Chair Beggs talked a lot about how, as a health district, we actually really have a unique board composition. That's not the same. The way we're formed here is not how it is at every health district across the state. And so from there, we transitioned to talking about what we're doing here that aligns with what's happening at the state level. So we've talked a couple of times in this meeting about foundational public health services and how those are part of what we do and what we're going to continue to advocate for through our legislative agenda. And that aligns with strengthening the public health system, promoting healthy and safe environments as well. One thing I'd really like to point out on here is the cross-jurisdictional sharing model. The state is really looking to our district as kind of a best practice for the work we're doing with Adams, Asotin, Columbia, Garfield, Lincoln, Northeast Tri, and Whitman related to our READY program and emergency response. Some foundational dollars in action. Not very long into my time here, this region was talked about on the Department of Health call because we have a growing number of syphilis cases. And foundational public health dollars actually help us address and respond to those increasing numbers, along with other communicable diseases like hepatitis A that Dr. Lutz speaks about. When I started on the 16th, we had 22 identified cases of Hep A. As of today, we have 68 cases. So, it's doubled, more than doubled since I've been here, and really shows how we can use those dollars to respond. I mentioned our emergency response. We are one of 2 coalitions in the state that supports over 1,000 partner organizations in 19 counties and 4 tribes of Eastern Washington. The reason that the READY system exists is to support healthcare systems through regional preparedness. So the priorities this year have been developing response plans, conducting medical surge evacuation exercises, having a 24/7 call system where people can respond. The READY program has responded to wildfire seasons, a major I-90 bus crash incident, power outages, at local hospitals, winter weather, healthcare access, supply shortages, and so on. So that again really adds to the state's ability to strengthen the public health system. Here at the board, we've talked a lot about the nurse-family partnership and how that is something we're doing throughout the region to promote healthy living, wellness, healthy and safe environments. We did, since our last board meeting, receive the expansion grant through the state. So we will actually be able to serve 206 families or clients in 2020. Treatment services. We're actually working to get a Hep C treatment protocol in place and up and running by the end of second quarter 2020. We've actually, our director of that program, Misty, has been working to eliminate our wait list for people waiting to get into the clinic here for treatment services, and we've actually eliminated that wait list and have 1,100 individuals receiving treatment. Environmental, public health, food safety, liquid waste, living environment, just kind of in the numbers for this year. In 2019, our Safe Schools program worked with 210 schools, which actually translates to over 80,000 students' actual lives, that are being touched through the programs and wellness activities that we promote and look at through school health and safety programs. Our data center has become a data hub for Eastern Washington. Priority Spokane and other organizations rely on us for data, which also comes through some of the Foundation of Public Health supports. But this is a really great way for the community to have up-to-date information on health issues and affected populations. And anyone can go to that website for dashboards and to see there's over 50 different indicators per county around the state that you can look at and see how your area is doing. We've talked, again about in the violence and the role that we've played as a health district. One thing I wanted to share with the state is that we do have the highest number of domestic intimate partner violence incidents in the state. And this is a really great example of upstream initiatives and ways that we can work to use the data, work with community collaborations, nurse-family partnership, and then come back and do program evaluations. So, one organization can't necessarily have the total impact that all of us working together can have. And that just shows how we can support that community work. Health equity, we've talked a lot about. I either have to hit the mouse or the button. Health equity is something that we're still keeping a watchful eye to. If you saw the Spokesman article today about where vaping industry is kind of targeting which areas that they're looking to promote tobacco products and other products in communities, there's definitely some disparities, right, that involve those communities. So that's something that we watch and we look at. Which reminds me, I think we introduced her, but she wasn't here. Kelly Hawkins is our new public information officer, and I think she joined the week after I did, so we're newbies together, but Kelly has been doing a great job. If you saw the NFP article, which was a great showing of some of the work that we're doing in the community, that's been a lot of Kelly's organization and assistance with getting the health district out in front of some of the program and some of the media sources. So to wrap up, where I'm kind of headed into January, I talked with the executive committee and I'm going to be bringing forth to them my operational work plan. And now that I've had some time to kind of get my feet wet and start learning more about the district and where it makes sense for us to operationally focus for 2020. And that is all I have today, if anyone has questions.
It's always a challenge when I come up after Amelia. I mean, all this uplifting, retro look, and then I'm going to talk about some of the illnesses we're dealing with in Spokane. But it's my life and it's our life. So, hepatitis A, respiratory, looking at influenza and pertussis and vaping. So as Amelia said, 68 cases as of this week. Last time when I presented to you, there were 53. And prior to that, there were in the 20s. So although we had a doubling in 1 month, we've significantly seen a decrease in that number. That doesn't mean the outbreak is over by any means. I mean, this can be a really sort of a smoldering type of infection and outbreak. But again, I think to some degree, it's a testament that the work that we're doing here at the Health District in collaboration with partners throughout the community is really making a difference. And vaccination is by far and away the best means by which we can prevent hepatitis A. And to think that with a couple of people in the agency leading the effort and then working with partners, since June 1st, we've given out 1,775 vaccinations for hepatitis A. And that's more than 1,600 individuals, unique individuals. And sometimes that's in small numbers of 5 and 10, like going to a warming shelter, going to the House of Charity, where maybe we'll do 15 or 20. Or sometimes it's like going to the county jail and doing 400. But I think, again, when you look at the amount of work that's been done in the last couple of months to prevent this outbreak from becoming sort of fulminant, again, I really think credit should be given to the immunization team that I see over there behind, to some of the epidemiology people who are not here, Lindia certainly representing them. But again, I think just real kudos and a call out. Although we have, unfortunately, the highest rates in the state, I think also the work that we are doing is really preventing this from getting a lot worse. And again, it's not over, but again, real kudos and to the people that are doing really the heavy work out there. I mentioned pertussis, and in your packet there is a provider alert. We put out a provider alert yesterday because we've seen an uptick in pertussis. Pertussis is one of the vaccine preventable diseases. It is incredibly contagious. So if you are a household member in some place where there is an infant or somebody with pertussis, you have about an 80+% likelihood of coming down with the infection. This is incredibly concerning because, again, the at-risk individuals are oftentimes infants. And so also when you look at how contagious this is, if I look at some values around, for example, influenza, for every person who comes into contact with someone who has influenza, they may infect maybe 2 or 3 other people. With pertussis, it's between 12 and 15. So again, incredibly contagious. It is oftentimes overlooked because it presents like a cold. But then what happens is you get this, what's the paroxysmal phase, and it's this coughing that doesn't go away. And so that's why it's sometimes referred to as the 100-day cough. So just to give you some perspective, I mean, again, this is, again, looking at pre-vaccination, 200,000 per year, 9,000 deaths, where we are right now, just to also demonstrate how this is a worldwide phenomenon. So in 2003, it's estimated that worldwide there were 1.76 million infections and over 275,000 deaths. That's pretty significant, okay? And when you look at contagious illnesses and how it affects especially infants, this is considered one of the most contagious and most devastating infections worldwide, especially in countries that are dealing with malnutrition and other issues around childhood. Vaccines, again, this is the recommended vaccination series. Is it 100% effective? No. Is it a good vaccine? Yes. And so again, there's a lot of criticism about the vaccine, about waning immunity. We acknowledge the fact that there is waning immunity, but we also know that if individuals are vaccinated and they keep vaccinated, then if they are exposed to it and they do come down with the illness, which does happen, the severity is oftentimes lessened. Let's see if I can do this just for, if I get this right. Najee? He said, just make it go. There we go. Okay. This is unfortunately, again, as I mentioned, this is most concerning in infants, especially under the age of 1, but especially under 6 months. This is an infant, you know, a couple of months old, and this is what it sounds like.
It's just kind of heavy. Uh-oh. There we go.
Not something you as a parent want to hear, not something you as a physician want to hear, not something that we as community members want to hear. And so that's why, again, vaccinating and trying to prevent little infants from getting this incredibly powerful infection is really essential. Let's see if I can advance. There we go. So again, 100-day cough. We really try to really push treatment as soon as possible. Unfortunately, oftentimes, as I mentioned to you, people come in, they present well after when you really ideally can try to get antibiotics in their system within the first couple of days. But we also do the best we can. And then what's really important is when we identify individuals who are infected, then we really push what's called post-exposure prophylaxis to prevent other individuals in their households from getting infected and or passing on the infection elsewhere. Really important, as I mentioned to you, again, to really emphasize infants and pregnant women, especially in the third trimester prior to delivery, because again, we know that their infants are at increased risk. Influenza, it's back. We're starting to see upticks, not surprisingly. This is the time for flu. This is how we monitor it. We're starting to see increased rates of hospitalization. And what I show you at the bottom is that typically how we monitor our influenza rates is by hospitalizations. And yet anybody who works in a clinic knows that we see many more patients who present with influenza or influenza-like illness before actual hospitalizations take effect. And so what I show you at the bottom is what we call syndromic surveillance curve. And it's just looking at individuals who have presented to the emergency room and have been diagnosed with either influenza or influenza-like illness. And as you can see, those numbers are increasing. I did not unfortunately have the curve for this week, but again, the numbers are much more significant for people presenting with flu, but not necessarily being hospitalized. And so this again speaks to the importance of syndromic surveillance and how being able to identify when these types of infections are occurring is essential so that we can make the community more prepared and more aware of what they should be doing and looking for. And again, this is just, again, where we are right now with, it's interesting also to take note that we're seeing a little bit more flu B than we would typically see at this time of year. Typically, you'll see a lot of flu A, and then as the season progresses, flu B. In contrast here, we are seeing a little bit more flu B, which is what has been reported nationally as well. Let's talk about vaping. I didn't know a whole lot about vaping a couple of months ago. I've become sort of a pseudo-expert on vaping, unfortunately. And we will have some experts talking about vaping in a little bit. But this is, again, what we're dealing with. And I think had we been looking for it earlier, we may have been seeing that there were individuals presenting to hospitals, presenting to clinics with symptoms that are now diagnosed as EVALI, or VALI for short, vaping-associated lung injury, but people weren't looking for it. We ask about tobacco abuse and tobacco usage, but we don't oftentimes always ask about vaping. Now we are. So these are the latest data, and again, 2,200 cases, 47 confirmed deaths. You may have heard a couple of weeks ago, there was a young 17-year-old athlete, reportedly a goofball by his high school classmates who had a bilateral lung transplant, okay, because he was vaping. So this is not innocuous. And although we have decades of research on tobacco use, we have but a few years on vaping. And again, I think many of us sort of see this as the tip of the iceberg. We're looking for stuff now, but we don't know what we're going to see in the future. And so to say that vaping is safer than tobacco, I think is sort of a misnomer. Sort of national, and you'll see that the states with the highest rates are in California, Texas, and what's that state up there? Is that Illinois, not Indiana? No. I didn't think so. Anyway, I just wanted to check. I thought it could have been Indiana. I'm not really good with my Midwest geography. So, but again, where highest usage is, and it's also interesting to take note that in our state, we have this is the national curve. You see that the numbers are decreasing, which is good. And this is what we look like in our state. We have 19 cases overall. There have been 3 cases now identified in Spokane County. We still don't know what the cause is. You know, you may have heard a couple of weeks ago, they identified a toxic substance of interest called vitamin E acetate, which is a diluent, which may be discussed later on today. But what's also interesting is that we also have individuals who are being diagnosed with this who have no history whatsoever of having THC in their system. So for example, in Washington State, a couple of these diagnoses, when they actually tested urine for THC, there was no THC. So we know they did not use THC products, and yet nonetheless, they have the diagnosis of Valley. So again, I think that the unknown still exists. So what have we done? The governor's executive, yeah.
On your map there, are those statistics for Spokane County or all the highlighted counties combined?
I'm sorry, that's the state total.
Okay. State or just the highlighted counties?
So those highlighted counties are the ones that have actual identified cases.
Okay.
And again, so you'll see just a handful of counties, and then again, Spokane County specifically 3 cases as of right now.
Okay. All right.
So in September, the governor had an executive order to address the vaping use. This is what he called for. What happened? It went to the State Board of Health. And in October, the State Board of Health unanimously agreed to ban flavored products. Why the focus on flavored products? Because we know that flavored products are a lure to young people. So we know disproportionately flavored products are used by people by vaping. I mean, the reality is that the taste of tobacco is quite different and not nearly as pleasant as the taste of bubble gum or Tutti Frutti. But we also, again, sort of saw this synergy between what's happening with vaping at the youth level and trying to address it there, as well as more broadly, really just trying to decrease vaping and exposure to. So this is what the Washington State Board of Health ruled. It went into effect October the 10th. There was a motion that was filed by Vapor Technology Association, a temporary restraining order that was denied on November the 8th. And then as of last week, the order was entered into the Supreme Court saying that, okay, the order is in effect. Vaping flavored products are not to be available for 120 days, which takes us into February, which takes us into the legislative time when there will undoubtedly be legislation enacted. That said, not surprisingly, this has been appealed, and it was appealed as of the 2nd. And so we have probably in 2 weeks for the State Board of Health legal counsel to basically address the concerns of the appeal. So this was, again, most recently at the State Board of Health that Amelia and Brian attended. This was another issue because of the findings about vitamin E acetate. There was a request to also prevent access to vitamin E acetate in vaping products. And so this went into effect as well. So another 120-day rule that takes us again into the legislative agenda. I throw this out there in that vitamin E acetate is again identified as a substance of interest, but not necessarily the smoking gun, so to speak. So we know that in a study that was done recently that 29 of 29 cases were found to have vitamin E acetate when they did what's called a lavage of the lungs. They found in those 29 cases, they all had evidence of vitamin E acetate. But again, that was a very small sample. And so this is really a fascinating study of how national CDC, states, and researchers are trying to ascertain the actual causes. Because you're looking at tens of thousands of different formulations. You're looking at hundreds of different products that are used to vape. And again, we don't know. And so this is precautionary principle at its finest. We're going to try to prevent something from getting out of hand without definitively knowing. And when we know, then we'll be able to better address how to deal with the issues. So that's my report. Questions? I think, again, the team can probably speak to how the FDA sort of kicked the can down the road. And I think had they been more aggressive in doing what they should have done about regulating the products, we probably would not be where we are right now. But again, that's hypothetical. So where we are right now, I think it's the same way that we are doing at the state level. We're looking at legislation to try to enact legislation to prevent access to vaping products. Vaping products come under preemption, correct? Yeah. And so again, if we create legislation at Olympia this session, and if the FDA at the federal level, they also provide legislation that it will supersede ours. And again, I'm always this whole preemption. I look to my policy and the vaping people to know the best because it's very confusing. But long story short, to answer your question, I think that if the FDA weighs in and starts to, for example, address flavored vaping products, which, as you know, has been sort of the conversation, but then also the pullback at the federal level from doing so, then that would really provide a great opportunity for all states to have alignment. Because again, I can go across the border into Idaho 30 miles away and find a completely different issue and instead of how they're addressing it. So again, I think if the feds were to weigh in, then it would probably solve a lot of the issues because again, that would supersede what we can do at a state level and local level.
But to get to your question, we don't have regulatory authority on products at the local health board, I think is.
So he cut to the chase really quickly, which is good. That's why he's the chair, and I'm just kind of rambling up here. Thank you, Brian.
Any other questions? All right. Thank you, Dr. Lutz. And Amber, do you have a legislative report beyond what we've already done today? So we'll go past that and no more financial. Then we're going to learn even more about vaping. So I'd like to invite one or more of those team members up and please introduce yourself and enlighten us.
All right. Hi, I'm Ashley Beck. I'm our senior research scientist here in our data center, and I'm going to talk to you a little bit about vaping, and then we'll bring up a lot of people that can speak a lot more about it than I can, but I'm going to let you know a little bit about the data around vaping and what we're seeing in terms of trends. Just to get started, I'm going to focus on youth vaping. We actually do not have adult vaping data available yet. So this is such a new issue that it will be added to our behavioral risk factor surveillance system, which is the adult behavior survey that we report on frequently. So we are hoping to and will have BRFIS data available about the adult population. But what I'm going to talk about is youth data and what we've seen. So this data point was just added to the Healthy Youth Survey in 2012. So 2012, this data point is the earliest information we have about levels of vaping. Some concerning things that we're seeing in the trends here, and the dark blue line is currently vaping, the light blue line is currently smoking, and the green bar is kind of ever having vaped. So let's focus on the blue line here, and what we're seeing with current use is a significant increase at several points in time from 2012 to 2018. We're also seeing that surpass where smoking was, and going back historically, much larger numbers of our youth are vaping than have smoked. So 1 in 4 are currently vaping, 2 in 5 have ever vaped. So how are youth vaping? This is an important topic when we get into prevention and understanding exactly some of these impacts. We see that around 60% of youth who are currently vape using liquid with nicotine. We see that around 31.5% report that they are using liquid with flavor only, which is interesting and important to focus on as well as that perception, because new research is showing that flavor only, the ones that are perceived to be flavor only also contain nicotine. So there's some misinformation about the product labeling and marketing research around there. Frequency of use, we have around 40% of youth who currently vape do so 10 or more days of the month. So this lets you know a little bit more about how often this is occurring and just the extent of the level of use. So who is vaping? We are seeing some differences in who is vaping. We're seeing older youth are more likely to vape than younger youth. This is true of other substance use as well. This has kind of a breakdown of some information that you can see more of on that County Health Insights website. But if you combine this teal with that dark green, the very bottom are cigarettes only, but you really see this portion of how many, those two combined, or how many are currently vaping. So 12th graders especially, that's around, 33% of 12th graders are vaping currently. So some other things that you can see on this slide here are who are more likely to vape. So I'm a prevention scientist. I want to talk about risk factors and how we can identify these different groups that are more likely to be vaping than their peers. And what we know about vaping is youth who are sensation seeking, who are failing academically, have depression, are using other substances or smoking, perceive the harm to be low around e-cigarette use, have a family member who use e-cigarettes, or have friends with positive attitudes towards e-cigarettes, are all things that we know and have established in this data that we have available, that these factors are increasing the likelihood that they will vape. So these are some of the risk factors. Additionally, getting a little bit at what Amelia touched on, we do see disparities in amongst who is vaping and some other differences based on some key characteristics here. So we know that females are more likely to be vaping than males. We know that Black youth especially are more likely to be vaping, as with American Indian and Alaska Native, are more likely than their peers. So you can see some differences by race and ethnicity. We also see some differences by the level of the mother's education. So that sometimes is used as a proxy for income and also as a key parenting risk factor. So this relates when we hear things like vaping manufacturers or marketers who are targeting specific groups. We see that in the data. We see these groups being more at risk and more likely to be using that, and we can use it to target. We can use it to target our prevention efforts as well. Okay, just to wrap up my data piece of this aspect, the key to prevention around vaping is really understanding why youth are vaping. So we can talk about some of these trends. I've talked about risk factors. But if we're going to talk about prevention, it's really important that we talk about why. I just have a little quote here that I'll read that says it's from a newspaper article couple weeks ago that Dr. Lutz shared that was in the Spokesman, and it says, recalling a recent incident at Lewis and Clark High School, a student encountered a shuttered bathroom and 2 signs on the door. One sign proclaimed that the bathroom was closed because of vaping, but slapped over it was another piece of paper with a more, I can't say that word, I should practice that one, poignant message. We're vaping because we're so stressed. So that's the part that really struck a chord with me, and that if we're going to be talking about prevention, we also need to be talking about why youth are vaping and how we can help support them with other healthier coping strategies so that we are getting ahead of vaping and other substance use. So I'm going to turn it over to AJ. And
it's a team effort, not just today, but over the last several months. So it's great that you're hearing from all of us today. I'll try not to touch both, Amelia. So I work on the youth tobacco, vapor product, and marijuana prevention team here. I'm the lead of our team, and I want to take just a moment to introduce the rest of them because they're sitting here. So Joel Reeves, my role as the lead is to serve the 6-county region in both youth tobacco vapor products, which is one grant source, and then the youth marijuana prevention. So I do a lot of my work outside of Spokane County, and then Joel is primarily implements our work plan here in Spokane County, but we work very closely together, and he does provide some technical assistance in the region as well. And then also with us, Julie Bongard here on the end also works on our healthy eating team, so you may have seen her in a different role on our team. She really provides a point of contact for cannabis retailers as we work to promote youth prevention of initiation of youth marijuana use. So Julie's that person that gets to talk to retailers. And then Hamdi Ali next to her, she's an employee of the CDC and she's with the Public Health Associate Program. We are her host site for 2 years, which started just a few weeks ago in mid-October. And she will evolve into our vapor product prevention specialist. So she's got lots of work ahead of her. So that's our team. And Joel will talk to you here in just a moment. I want to talk a little bit about our strategies, and it's important to know that these strategies were in place before EVALI. As Dr. Lutz mentioned, he got to become an expert pretty quickly in vapor. We knew a little bit before EVALI, and it's been helpful actually in helping us implement some of these strategies. So we really focus on preventing initiation among youth and young adults, so ages 12 to 20, of all three of those products: traditional tobacco, the vapor products, and THC or cannabis. It's really important to know that, and I think Ashley and Bob shared this, THC and nicotine can be vaped. And there are some perceptions that among young people and adults that they're vaping just flavor, but we know that there's some traces of nicotine, at least in those flavor-only products. We also know that youth who vape are more likely to start smoking combustible tobacco cigarettes, so that's an important piece to mention. And as Ashley mentioned, there are disparities, so we really tailor our efforts toward who we know is vaping or more likely to have those risk factors. Currently, our program is collaborating with local schools to enhance policies and procedures related to prevention and intervention strategies. School districts that we're working with in Spokane County currently include Spokane Public Schools, Cheney, Meade, East Valley, Central Valley, and we're starting conversations with West Valley with Linda's help, which is great. We aren't, in some of these districts, we're talking at the district level, and in some of them, we may just be working in one school in that district, but our goal is to get into the district level and look at system-wide changes. We also have a partnership with the WSU College of Nursing to facilitate, nursing students facilitate tobacco and vapor product prevention and cessation groups for a short term during part of the end of their second year in nursing school. And the students at the high school level that participate in that are identified typically through the school counselor or a student assistant specialist if they have one in the school. These youth typically have at least experimented with vaping, or they have a parent who smokes or vapes, and so we know that they're at a higher risk. Another strategy is to increase health care providers that are asking about tobacco and vapor product use, and then refer to cessation interventions. In this area, our primary focus has been on low-income individuals and the maternal population or women of a childbearing age. And rolling into the promotion of tobacco and vapor 21, we'll be really focusing on 18 to 20-year-olds and increasing cessation resources for them as the law goes into effect January 1st of 2020. So if you're not aware, Tobacco Vapor 21 or TV 21 will go into effect in our state, and that means the legal age of sale for tobacco and vapor products will increase to 21. And then the other strategy is enforcement of smoking in public places and the Vaping Resolution 1601, which this board passed in 2016. That's one of Joel's jobs. I don't do that. And interestingly enough, in 2019, the majority of our complaints came from either indoor vaping or vaping within 25 feet. So thank you for passing that. These, as I mentioned, these strategies were in place prior to EVALI, but that has really helped us start conversations with schools, administrators that we were trying to reach out to before, but this really shifted priorities for schools. It really rose to the top. And in talking with school staff, including principals, teachers, and administrators, we've learned that there's a lot of misconceptions or confusion about vapor products, including what they are. Why is public health concerned? What's the harm and risk for these products? So in the next few slides, we're just going to go over some of the things that we share with young people and with not just school staff, but concerned community members as well as parents when we have requests to do that. And we will do presentations, but our ultimate goal there is to talk about some policy and system change and how can we really have an environment that's healthy for these young people. So I'll share a couple of things with you related to marketing strategies. And I just want to call out this top slide on the left is meant to signify the similarity in vapor advertising strategies to traditional tobacco strategies, which aren't allowed anymore. But they've looked back to some of those from the 50s and 60s. They knew they worked, so they're using similar techniques. And then Juul, as Ashley mentioned, we have 30-some% of high school seniors vaping, and it's really increased over the last couple of years. And Juul really changed the marketing strategy for the vapor industry, and we saw a widespread use among young adults and young people in high school with it, and bringing a Juul onto the market. And then we've heard from these companies forever that their product is meant for cessation for adults. They don't intend to market to children or for children to use their products. But when you have an icon like Santa Claus in your marketing, I think that sends a little bit different message. And then we also know in many industries, the packaging of the product itself really is marketing. And flavored products have been banned in our state, and many of these types of products are no longer legal to put on the market. But just to show you the type of flavored products that are out, what they look like, and let you decide who you think these appeal to.
So I'll be talking more about the health concerns and the addictive nature of vapor products. Regardless of the substance inhaled, there are dangers to inhaling foreign substances. During the vaping process, liquid is atomized and heated to produce what we call ultrafine particles. These particles are on average 1/10 the size of particles inhaled from combustible tobacco products or cigarettes. This allows the particles to be inhaled all the way into the alveoli, the smallest and functional parts of the lung. There are fewer defensive mechanisms in the alveoli. Inhaled ultrafine particles can damage cells responsible for maintaining alveoli structure, fighting off infection, repairing from injury, and damage the cells that make respiration possible. Ultrafine particles can transport chemicals found in vapor liquids, vapor product components, which are often the source of the heavy metals or silica, and unknown chemicals that are byproducts of the vaping process into the alveoli. Ultrafine particles that reach the alveoli are more efficiently absorbed into the bloodstream, therefore increasing exposure to chemicals. So vaping, again, regardless of the substance vaped, can compromise the structure, function, and ability to combat and recover from injury or illness in the lungs, and will have unknown consequences due to the increased absorption of an undefined number of chemicals with potentially unknown health effects. Nicotine is a highly addictive substance, comparable to that of heroin. The presence of high levels of nicotine changes the way a brain develops by decreasing natural neurotransmitters and receptor sites. This negative feedback loop makes normal brain function difficult without supplementing nicotine. Underage consumption has additional consequences, such as decreased impulse control and attention span, which increases the likelihood of other risky or addictive behaviors. This is well understood, but the greater risk of nicotine addiction from vapor products is not. Combustible tobacco is terribly inefficient at delivering nicotine, with around 9% of the nicotine actually being absorbed into the bloodstream. Salt-based nicotine products, Juul pods being the most popular of these products, are highly efficient at delivering nicotine, with around 70% of the nicotine being absorbed. A pack of cigarettes and a single Juul pod provide approximately 200 pulls or puffs. One Juul pod provides 1.5 times the amount of nicotine as a pack of cigarettes. That means each pull or each puff from a vapor product, primarily a Juul pod, has 50% more nicotine than a traditional cigarette. Yes. It's funny, it's about 2 bullet points away. Yep. The higher the nicotine intake, the more rapid and severe the addiction and impact on brain development will be. The culture of vaping has people, especially youth, consuming multiple Juul pods per day. It is not unheard of to have people vaping 6 to 7 Juul pods in a single day. Supply chains for underage access to vapor products are well established. Age authentication for online ordering has no standard or oversight. All FDA compliance checks for selling vapor products to a minor failed in Spokane in 2019. Due to social norms and a lack of enforcement on providing tobacco to minors, friends and family members are the most common sources of vapor products for youth. We know that one of the best ways to decrease unhealthy behaviors is through economic disincentives, or taxes. The numbers you see on this slide are from before the October 1st tax on vapor products. When compared to the cost of cigarettes and after the purchase of a vapor device, which are typically under $30, vapor products are 70 to 98% cheaper per dose of nicotine. It can be as little as 1 penny for the equivalent amount of nicotine that is found in one cigarette. Vapor products were on the US market for 12 years before being taxed in Washington state. For a variety of reasons, we failed to recognize and act to the threat of vapor products until healthy youth and young adults lost their lives. We at the Youth Tobacco, Vapor Product, and Marijuana Prevention Program urge the Board of Health to look at the science and not hesitate to take proper courses of action to address this epidemic. Our contact information.
Me again. So I am going to summarize policy, landscape, and say a lot of things that you just heard from Bob, from Ashley, from AJ, from Joel. I will kind of loop back around to it, so it'll be a good segue. Just a reminder that the legislative agenda that was just adopted does include substance misuse prevention and treatment. So this is something that I will be keeping an eye on. I'll monitor the relevant bills that are happening and keep you up to date. Bob did talk about the activities, the very exciting activities that have been happening at the state Board of Health level. I was also at that Board of Health meeting last month where they adopted the new ban on vitamin E acetate, which also required the listing of products that are in vapor products, the actual ingredients. That hasn't been done so far. And also requires vapor retailers to post warning signs on their doors. There were some folks from the State Department of Health at that meeting who provided a quick overview of the compliance to date, and they found that a lot of the retailers have been complying with the flavor ban, but that also some vapor retailers were getting creative and not selling flavored vapor products, but selling flavors that you could add to your vapor products separately. So people are getting sneaky. There was also some public testimony at that meeting. It was less exciting than anticipated, but I can summarize some of it because it does speak to some of the potential unintended impacts of these kinds of rules. Some of the folks there were mostly stakeholders from the vapor industry. There was a cannabis retailer, a vapor retailer, cannabis producer, and other industry type stakeholders. They said that the rule is leading to fewer customers and employee layoffs, argued that vaping helps people stop smoking and that there's no vitamin E acetate in nicotine vapor products or illegal cannabis products, but I don't think we've heard that from the CDC yet. They argued that individuals who use flavored vapor products are going across the border to Idaho, they're buying things online, as we've heard, or on the black market, or switching to combustible cigarettes. And there was concern raised that the black market products not only include pesticides and heavy metals, but more of this vitamin E acetate. But as you heard, ultimately the board did decide to keep that flavor ban and also add the vitamin E acetate to the ban. There are things we can do. There are scientifically supported policies and programs to prevent vaping. Smoke-free policies for indoor air, that one we are great at here in Washington State. There are efforts to increase affordability of cessation therapies. So could it include things like eliminating out-of-pocket expenses for folks who are undergoing that or reducing patients' co-payments. Statewide comprehensive tobacco control programs are evidence-based and scientifically supported, and those could include things like multi-pronged strategies at the state level that have educational, regulatory, clinical, social, and economic strategies all rolled into one, like restrictions on tobacco product marketing and availability, mass media campaigns, cessation services, and smoke-free policies. There's also some evidence that tobacco and vapor product marketing restrictions reduce use, though there's more evidence would be helpful here. But there are studies showing that tobacco marketing increases youth use and experimentation, and that removing certain types of displays like Powerwall advertising displays from checkout lines has been shown to decrease adolescents' likelihood of smoking. However, why don't we just go tell all the people that they can't advertise vapor products to youth anymore? We are limited in what we can do by state law. A 2005 ruling by the Washington State Supreme Court set a standard that tobacco prevention and control policies had to be enacted at the state level. So that prevents local jurisdictions from adopting more comprehensive policies than at the state. And in fact, Washington State is one of the most preempted states in the nation, tied only with Michigan. And so we're preempted from advertising, licensure, smoke-free indoor air, and youth access legislation. Things that we would like to be able to do, for example, that we currently cannot, include banning, if we were able to ban flavored vapor products at a county level, any sort of local taxes to discourage youth use or fund prevention efforts, and using local regulations or local enforcement to change those point of sale and advertising laws around tobacco and vaping. More to come on preemption as the legislative session moves forward, I expect. And then as we heard from all of the previous presentations, it's clearly, there's a lot of importance in focusing on youth and prevention efforts. So AJ and Joel shared what we're doing here locally about reducing or preventing youth use and targeting approaches for those high-risk youth that Ashley talked about. And I think that there are opportunities to go even farther upstream and look at how we can support youth to ensure that they have healthy coping skills and self-regulation so that they aren't opting towards vaping. That sign that was on that bathroom door, I think really speaks to what youth are going through and that they're using vaping as a coping mechanism. So how can we help with their self-regulation skills so this isn't an issue? And at this point, I would like to invite AJ or Joel back up to talk to address the previous question. Yeah. Thanks. Any questions about policy before I step aside? Thank you. Thanks. Yeah.
So getting to the behavior, Chuck, every school deals with this differently. Every school district deals with it differently, and then the individual schools within. Many of them, as evidenced in that article, the spokesman Lewis and Clark has shut doors. Central Valley did last year, U-High. I know that some schools have purchased vape detectors for the bathrooms. They're very costly, and just preliminary feedback from schools that have done that is students can trick them very easily. If you blow the vapor into a running faucet in the bathroom, for example, the detector may not detect. There's also some concerns that came up at the Vape Summit at North Central, which the article was written about. One of the young women on the panel is a student athlete, and if she's in the bathroom and a vape detector goes off and there's 6 kids in the bathroom, 3 of them vaping, 3 of them using the bathroom, somebody comes in and nobody knows who actually was using the vaping device. The gal at North Central is the student assistant professional. She went into the bathroom one time, there were 7 girls huddled in a bathroom stall passing a vape around. And she says, girls, what are you doing in there? Oh, we're gossiping. She said, you can do that in the hallway, come with me. So there's so many youth, for example, in this situation, one device. And so identifying whose it is, who's used it, like there's so many complications around enforcing this in the schools. And a few weeks ago, well, the same day as the Board of Health meeting here in the state, we had a strategic planning meeting for our tobacco and vapor work plan to the state. And we had several representatives from schools up to the administrator of Meade School District. And his biggest concern is my principals need to be observing instruction because our primary role is education. And enforcing this vape thing and dealing with behavior is taking us away from what we're here to do. So he came to that planning session because he wanted us in public health to know we need your help. We cannot do this alone. We are not the experts. And I really think that goes beyond our team. Like we're gonna need to reach out to our leadership, executive leadership, and you as the board to help us help the schools because that's where students are gathered. That's where these behaviors are occurring. And as you mentioned, it's become a real concern.
Thank you so much. Do we have an executive session today? We do not. Excellent. All right, we're down to board member check-in. Start with Councilmember Thompson.
So recently, I've just been at a couple things, National League of Cities Conference, and then working with Association of Washington Cities. And at the National League of Cities Conference, a lot of people were approaching me because of being from Washington State, asking about marijuana. They're looking at it, what could they do in their state for the money that it will bring in? And there was a lot of conversation. I shared a lot about if it's by initiative, you can lose control very quickly because the legislature can change. In our initiative process, the legislature can change things after 2 years. So the money that was intended for prevention and treatment and aftercare and all that gets swept away. And a lot of folks had no idea how the initiative process worked in their states, and so they were going to go back and take a look at that. And I just said to really look at our healthy youth survey data and that kind of thing. One of the things that I think is interesting to point out from the Healthy Youth Survey is the perception of the youth of what the adults think in their community about should they drink, smoke, or vape, or use marijuana. And they think, obviously it's very high for not smoking cigarettes, combustible tobacco products, but very low for the vaping, marijuana, and alcohol, really. So that brings to mind about community laws and norms, which I think is extremely important for this board to be looking at in our education and our outreach, is to, when you talk about the parents have a big role in this, I think that's extremely important for them to learn and understand, because they think it's just steam, or it's just vapor, something not going with the vaping situation. The other partnership that I think is important to look at is all the other state agencies who are doing things. I'm on the Washington Traffic Safety Commission's Washington Impaired Driving Advisory Council. At our last time meeting, they're doing public service announcements about not driving impaired once you've been smoking marijuana, using marijuana. And it's called Good Talk. And what they did was a survey about who is using marijuana, and they surveyed 800 people in the state, found out that they're, late 20s to mid 30s, and that they liked outdoors, they like dogs. And so these commercials they had, or public service announcements, they had a young woman with her dog in the woods, and she's petting the dog, and she says, "So, you're smoking weed? Cool. But if you really need to go anywhere, call me, and I'll come and get you so you don't have to drive." Good Talk. The series is called Good Talk. And then there was a young man who also does it in Spanish. He's a Latino man, and he does the same thing. So you come home from work, you want to relax, you smoke some weed, cool. And then says, "But call me." The issue with this is traffic safety, and I said this to the board, traffic safety is in a silo here, not realizing the message they're putting out. They're saying, please don't use and drive, but the whole cool. So I sent messages, and now they have edited those and they have removed cool, which is good, but it's still, for our kids to just hear, "So you're smoking pot, cool." We've got to start working together more in messaging together, and I really would like to see, as you were talking about a regional legislative working together, we've got to come together with other agencies who are doing their messaging that really doesn't support overall good health messaging. So that was just my thing, and then I had one more thing. It's about the Association of Washington Cities. Oh my gosh, I brought it. About alcohol. I think I told you at one meeting, the Association of Washington Cities had their regional meetings, and they called them Cities on Tap. And I was told that it was about, when I questioned, I said, with the number of people who are in recovery and the number of people who wouldn't want to go to a bar for a regional meeting, I don't think this is appropriate. And they said, well, it's tap water. It's the flow of ideas. Well, this doesn't look like tap water to me. This is what was there. This is a drink button, or whatever this is. And then this is a, what is that? Coaster. So I am going to go, we have a meeting tomorrow over in Seattle, Seattle. And so I'm going to go over tomorrow again and say, I don't think this is appropriate use of membership from cities when we're working on like boards of health and things. So I guess my point is I'd like to see over the next year, and my check-in is, I think we have a lot of partnerships to build, a lot of messaging to talk about, and really making sure everybody's on the same track for good decisions for our youth and in turn adults.